name is Alma Morgan. I've worked for 25 years at VCU Medical Center in Richmond, Virginia, as transition coordinator and educational consultant for the Pediatric Hematology Oncology program. So I've always got up every morning and went to work and thought I had the best job in the world, and I still do. I retired from education in November and went back the following week, back to the hospital, back to the same position kind of, to keep on doing it. And the director asked me the other day, said, how long are you going to do this? And I said, probably till I'm 90, because it doesn't seem like a job. I love the patients and I love the families. So it seems like, as one young lady told me in the young adult group this morning that I was working with, she said, I want to make a difference in the lives of others, and I want a job where it doesn't seem like work. And that is what I have gotten with this position. So prior to that, I did teach in public school. I taught children with disabilities and loved every minute of that also. So worked in adult education some. The only one that almost killed me was correctional education, that I thought I would try for about 18 months. And I went through a couple windshields and numerous headlights, because they'd get out on work release when they weren't in class to mow grass, and they'd break my windshield and my car lights and whatever else, because they said, Miss Morgan, you act too much like a school teacher here, and we are not like those kids in school, in typical schools. So they were going to prove that to me, I guess. But the Pediatric Hematology Oncology program is one that I have learned a lot. As an educator, we think, as parents, we think we are teaching the lessons. And in reality, our children are teaching us the lessons each and every day. So a few years ago, I did write a book about the lessons I've learned from my children with cancer and chronic illness, and how that applies to education. And I'm going to talk a little about that, and we're going to go into educational challenges and strategies and interventions. We want to believe that in this world that everybody is going to be compassionate, caring individuals, and that when we send our children back to school, it's going to be a piece of cake. The need for normalcy. We all know, as we get up as adults and we go to school work every day, that is our routine, that is our schedule. But when it's taken away from us, we don't have that normalcy anymore, and we suddenly miss it. So what do we do with children with a new diagnosis? We say, okay, you'll be on homebound instruction. And years ago, they were on homebound instruction, let's say for leukemia, for an ALL, 2.5 to 3 years, they would be at home. And we found that that really did not work, because they were isolated from their peers. They got behind academically, because 5 to 10 hours of homebound instruction a week just doesn't cut it for 3 years. Socialization with peers, extracurricular activities were out, and they became depressed. And the more they stayed home, the harder it was to transition back. So anxiety ran high, and it was difficult. So what we found, let's get them back as soon as possible. And so that's when we really tried to make an effort to work more with the school divisions on transitioning them back to school. I often hear, and it's not me, because you can tell I don't live in the gym, but for the adults who say, you know, I didn't get to the gym this morning and I really feel it. You know, these children really feel it when they don't get to school. And the more they don't go, the harder it is. And I spent my morning before lunch and after lunch in 2 different sessions with our teens and young adults that are in college. And we did a lot of sharing, and they talked a lot about the anxiety. So the need for normalcy. When any of it is taken away, we feel a loss. Children that I've had over the years that hated school prior to the diagnosis. I don't like school, I don't like school. Suddenly given a diagnosis of childhood cancer, Miss Alma, I want to go back to school. Get me back to school as soon as possible. So suddenly they love it. Strength. We used to think, and I'm going to tell my age here, the Popeyes of the world, that strength was built on eating your spinach and your mussels, and you know how strong and how big and how you know and strong you were. But strength really comes from our young people who have dealt with these chronic illnesses, dealt with cancer, dealt with those adult things in life that we have never even had to deal with. And the strength that they show when a 5-year-old who with a brain tumor wakes up and suddenly she cannot walk, she cannot speak, she cannot write because she can't hold the pencil, and she was once right-handed and she has to learn to do everything with the left hand. And we're working, and I'm working with her on a daily basis, and I'll finally, and I'll say, do you want me to do that for you? No, Miss Alma, I can do it myself. That is strength. Kids have worries too. I do a summer enrichment program and an after-school program where I don't allow parents to come. I say they come, and we have some teachers there, and they spend after school from 3 to 6:30 with us every afternoon, one day a week. Or in the summer, I'll do a week program from 9 to 3. And it's funny, in the morning I start my sessions with things that we are thankful for. And I go around the room, and they say, I love being here because everybody understands. And this group, the elementary age group that ranges anywhere from kindergarten up to middle school, they've been together for years. They come when they're kindergarten, then they love it so much they come back in first grade, second grade, and they keep on coming. And they start sharing and talking, and of course we have new ones in the group. But as we're going around, what are we thankful for today? And when you have a 7-year-old or an 8-year-old saying, I'm thankful I'm alive because I had leukemia when I was 3. Or I'm thankful for my family and my mom and dad because they were always right there with me. And they always stayed with me and they comforted me. Or I'm thankful for my brothers and sisters, and I'm thankful for my dogs and cats, and the list goes on and on. They might not tell you they're thankful, but they are. But then we say, what do we have? Do we have any worries today? Well, I'm worried about going back to school in the fall. I'm going to start middle school, and I hear middle school students are really mean. Or I lost my leg, and Miss Alma, they're not going to understand that I have a prosthesis, and they're going to make fun of me. So we got to start working on those things now. Or I'm worried that my cancer is going to come back. And I'm worried I can't tell mom and dad because I don't want to see them cry anymore. So these worries are really big, and they're not going to tell you, and that's the one thing that I have learned the most. Sometimes they don't share their innermost thoughts with the parents or the loved ones because they know you're worried too. I learned that from a personal aspect last November, after working with chronically ill children for 25 years. And my daughter, who's in her 5th year of architecture school at Auburn, Alabama, had to come home and get a pacemaker at 21. And I started going to the doctor, and I started asking all these questions, and she'd look at me and shut up, Mom. And then she'd go, I can go to the doctor by myself. Okay, all right. And I'd go, I'm worried. And she'd go, I know you're worried, Mom. And she'd go, Mom, I didn't tell you this that was said at the doctor's last week because I don't want to worry you. So no matter how old they are, how young they are, they protect us. And so what do we have to do? We have to grow bigger ears, and we have to get in there, and we have to pay attention to their facial expressions and to their moods and to what else might be going on with them, because they do worry about us. Take time and detour. This is a hard one as a parent. I think that as adults, we grow up on timelines and schedules and routines. We got to do this today, and I got to get to work, and I got to get dinner made, and I have to make sure that so-and-so gets to ball practice, and so-and-so gets to ballet lessons, and I got to do this and this and this and this, and it goes on and on and on. So in my tutoring, I've learned, I had a little girl that mother was bringing her to me for help with reading. And it was in the summer before school started again, and we were doing flashcards. And the mom came in that day and she said, we're going to have to put our dog to sleep because he's not doing well. We've had him for years and we're really worried about it. So Mom left, and we sat down to do the flashcards, and I was showing a card. And she would say the word and give me a sentence about the dog. And I'd go, oh no, we're trying to get through the words quickly today, and then we can read our book. So just as quick as you can, say the word, and we'll go to the next one. And I went to the next one, and she gave me another long sentence about the dog. And I got to the next one, and she gave me a whole paragraph about the dog. And I thought, this is not working. I have to detour. And I said, would you like to get on the computer and write a letter to your dog? And she said, that would be great. And she wrote this lovely letter to the dog about how much she has loved him and what a good friend he's been. And then she drew a picture of a little girl and a little dog, and they both had smiles on their face. And when her mom picked her up, she was happy and she left. But I had to detour that day. I had to take time and detour. And it's like it goes back to when the kids have worries. We have to pay attention. They might miss ball practice that day, or they might miss the ballet lesson, or dinner might be at a later hour, or we might not have time to cook dinner. But we have to address those things, or we have to just be present when they need us to. And I always say, put them in the car with you and drive around, and they're going to open up. You don't have to say much. Suddenly they'll start talking to you, and their innermost thoughts are going to come out. And I had one mom stop me today, and she was telling me about her middle schooler, and I said, yeah, he came into my session this morning, and we had kind of finished the first session. He kind of walked around and kind of just eyed us and was listening to what we were talking about. And then he came back after lunch, and he came into this new session. And he sat down, and I didn't really think he was listening until every now and then he'd chime in, and he was hearing every word that we said. So sometimes we just have to pay attention that way to where they are. Who in here has a bucket list? Raise your hand if you have a bucket list. This is sad. Raise them high. 1, 2, 3, 4. 4 people? Y'all know what a bucket list is? Where you list the goals and the things that you want to accomplish in life. All of you in here need a bucket list, but your children need a bucket list too. And they probably have them, or they might have them. We worked some on that this morning in our session. I do retreats with our young adults all the time in Richmond once a year. And I had one call me that had been treated with a bone marrow transplant when she was 9. And she called me just, I guess it was in January. And she said, you remember that activity you did at the retreat last year? And she said, you gave us a little card, and we had to list 5 things we wanted to accomplish within the next few years. I said, yeah. She said, well, I wrote down 7 things, and I accomplished 6 this past year, Alma. And she said, I couldn't believe it. She said, I remember I said I wanted to finish grad school, and I wanted to get a job, and I wanted to work in a hospital with children. And she said, and I remember I said that I wanted to meet somebody special in my life, and I wanted to get married, and I wanted to have a family someday, and I wanted to write a book someday. She said, well, I did 6 out of 7. She said, got my degree, got a job, I'm working as a social worker with children. She said, I met somebody, I'm getting married. And she said, and the biggest surprises of all, I was told I would never, ever, ever be able to have children. And she just had a baby boy. She said, it's because I wrote them down and I looked at them. She said, it works. You got to have a bucket list. And as you complete one thing, and this is what I told her, I said, well, your bucket list is almost empty, so you have to fill it back up. Because if we don't, we just exist in life. I know all of you parents are going through really, really hard times. Trust me, I know now more than ever. And I know how you lose yourself and you just think, I got to just get through the day. But you do have to get through the day and the next day and the next day and the next year and the next year and the next year. And you have to keep going, and you have to have something in there that you're striving for. You don't want to just exist. You want to make a difference. So fill that bucket list up. Fill it up. Places you want to go, things you want to see, things you want to do. Pride, attitude, and perseverance. Who knows better than Forrest Gump, right? Pride is the one thing, it can be good and bad, bittersweet. Pride's the one thing that makes us hold our head high and say we can accomplish anything and everything. We can take on the world. But then pride is the one thing that keeps us from asking for help when we need it the most. Attitude, positive attitude. If you go back and you do your research, you know this. When I look back over 25 years of working with the young people and the young adults that I know now, that I've known for 20-some years, and I look at the ones who have been successful, it's been their attitude. It's been the ones with the positive attitude. Yes, I had cancer, but I'm not going to let it hold me back. I always said I wanted to be an attorney, and I'm going to be an attorney. I always said I wanted to go to nurse, so I'm going to be a nurse. It's like the girl I just told you about with the bucket list. Positive attitude and the perseverance to keep on trying. And you might not get there on the first attempt. You might not get through college in 4 years. It might take 6 years or 7 years. Young man that I've worked with, I met him when he was 14, diagnosed with ALL. He's 35 today. His mom used to come in my office and say, please make him do his schoolwork. They're going to kick him out. He's going to fail. I know he has this leukemia, but he is going to fail, and he doesn't want to be held back. Please make him do. And I'd go in his room, and he'd be under the covers, hiding from me, pretending he was asleep, or hid in the bathroom. And we developed a friendship over the years. And I've put him in college, I know, 4 or 5 times. And due to the late effects that you've heard a lot about today, he got to be in his mid-20s, and he had a lot of heart issues. And they told him he was going to need a heart transplant. And he went on the list, and I talked to him a few days right before the heart transplants, and I said, because you grow to love him, do you really want to do this? Are you scared? He said, I don't want to live this way anymore, Alma. He said, I can't do anything. Yeah, I want it. He had it. He got through it beautifully. A week or so after he got out of the hospital with the transplant, he said, I'm ready. Put me back in college. I said, I've tried 5 times. He said, I'm ready now. He just graduated with his 2-year degree, and he got accepted into radiology school where he wanted to, the hospital where he wanted to go to radiology school with 3.8, 4.0, somewhere high like that. He did it because he was ready. Now, he didn't follow the standard mold of doing it in 4 or 5 or 6 years. It took him a lot longer, but he got there. Silent suffering. People used to say to me, isn't it sad working with those cancer kids? I'd go, no. And they'd go, the poor little things, they just suffer. And I'd go, no, they're pretty happy in clinic. They're laughing and playing games. And then I would think about it, and I would think about everything, about them not sharing their innermost with the parents because they didn't want to worry them, and how protective they are. And then I realized a neighbor I had that was diagnosed, that I had known him since this age, and he's the same age as my daughter, and he was diagnosed at 20 with leukemia. And then he became septic, and he was in the hospital for 3 months and had to learn everything over. And he'd want me to come see him, and we'd sit and we'd talk. And he'd kind of smile, and he couldn't move anything at that particular time but his head. And every now and then tears would just roll down his cheeks. Silent suffering. Sometimes, and this is where I get so mad at teachers, and this is what you have to let them understand. Sometimes when we send children back to school and they look good and their hair's back out and they've been, you know, they're okay, they look up to par, you know, but they have the cognitive deficits, they still have fatigue. It takes them 4 and 5 hours to get through the homework at night. That is silent suffering because they have high expectations put on them. And they think they have to perform, And the person on the other side, those staff members, they don't understand. That's where, as parents, we have to help them understand. We have to realize, hey, I'm going to bed at night and my child is still in his room, staying up trying to get through hours and hours of homework. Or they're coming home, these elementary age young people, they're coming home and they've been in school all day and they have the fatigue and they have them, and they're tired as anything. And we're saying, okay, you got to do this. No, you got to test tomorrow. Come on, we got to do it. And sometimes we have to cut it off and say, hour and a half, 2 hours, that's enough. No more. I'll write a letter to your school. And I've learned that through to this afternoon's tutoring. Had a 5th grader, very bright, had a brain tumor, and she's done beautifully. And but we'd start working, particularly on math. And she'd start crying, and she'd go, I've been working on it 3 hours, I'm so tired. I'd go, no more, no more. I'm writing a letter to the teacher saying homework wasn't finished due to fatigue. No more. And sometimes you have to intervene like that. I know it's a balancing line between that normalcy and expectations and those subtle accommodations that I'm talking about. But we have to do that because we do not want our children to suffer. Belonging. This is another one. All of our young people need to feel that they belong, that they have a social group in which to belong to, and that they feel different. It's no doubt. I've had cancer. I feel different. And it's real. And that's the first thing that the psychologist I work closely with has taught me. You have to recognize no matter what, they are different, they feel different, and they are different. And you have to let them know, yep, I understand, you are different. Because a lot of times we hear them say, I'm different than those kids at school. And we say, no, you're not. Yes, they are. Those other kids at school didn't have cancer. They didn't go through what our young person went through. So we have to acknowledge it. And we have to find a social group in which they can belong, whether at school or in the community. This morning I had several in there saying, it kind of weighed. Half the group told me, I don't have any true friends at school. And then the other group said, I'm just kind of friends with everybody. I felt better about that. For the ones that said I really don't, they're the ones that also said I don't like going to school. And the anxiety is so high. So they come into clinic and we're transitioning back and I'm saying, or we're starting a new school year, and I'll go, well, are you anxious to get back to school, to your friends? I don't have any friends. Well, we got to have some friends. What about art club? I can't draw. What about music? I can't sing. What about theater? Are you crazy? You think I'm going to get on stage and perform? Well, what about wood tech? I don't want to make things with the tools. What about chorus? No. And the parents are ready to kill them because they're saying none of this is working. What about band? I'm not going to play an instrument. I don't want to. So then we have to go in the community. Church, recreational activities at the community center, extra intramural sports. We have to find a group so that they have somebody or something to belong to. None of us want to go through life alone. None of us. The worst thing, too, that I'm going to throw this out here because I was thinking about this the other day, and it's so true. We allow children to escape to their rooms with movies and video games and iPhones and computers. That's their escape, but they don't have a social group. And we're losing them. And they're isolating themselves. It's okay to cry. I know, and I've watched people in our hematology oncology division, the support staff, come and go over the years. And some say, I can't do it anymore. It's too hard. And I've had others say, why'd you stay so long? You've been here forever. And I say it's okay to cry. That's the one thing I've learned. It's okay to cry, people. We all have emotions. We all have feelings. Sometimes even as parents, husbands and wife, we're not on the same page. I know even with my own husband, sometimes I'm crying and he'll say, "You're supposed to be strong." Well, I'm strong when I need to be strong, but if I want to cry, I'm going to cry because it's going to make me feel better, and then I can get up and be strong. It's okay to cry. The gift, Molly. This reminds me of her. Molly was a college student I was working with this morning, and career goal. And she said, "I'm not sure what I want to be when I grow up." She said, "But I know I want to make a difference in the lives of others." What a perfect career goal. I said, "That's all you have to write down, because that's what you'll do. And that will be your gift to life." And that's what we have to help our young people do today. All of them in there that were doing the advocacy boards with me this morning, I had career goal there. I know some of them were in the 7th grade, younger. And some of them, it might not be really what they will do, but they were thinking about it. We have to teach them what their gifts are. So they had to put on their poster their strengths and their weaknesses. And we have to capitalize on their strengths. What are your true strengths? And not make a big deal about the weaknesses. So the gift, help our children learn what their gifts are and how to share them with others. We all have challenges, and I'm getting into the educational part now. After a diagnosis, we all have challenges. I have never met anybody to go through treatment that didn't have challenges. But I have never met anybody that did not go through treatment, that is perfectly healthy, never had a diagnosis, that did not have challenges. We all have challenges. And I was in there today and I said, "What are your challenges?" And they were looking at me. And I said, "My challenge is I can't read them out. I'm not wired that way. And my husband doesn't understand. And I have technology challenges. I put together a great PowerPoint. But when I'm moving slides and doing all that, I'm screaming for my child to come and help me. Help me. I don't know how to do this." We all have challenges, and we have to know what they are. For our young people, we have to let them know what their challenges are so they can advocate better for them. Now let's talk about the challenges after a diagnosis for our survivors. Physical, cognitive, social, emotional, spiritual, and academic. What are the physical challenges? I have one young lady that's getting ready to be a junior this coming year, go back to school after her diagnosis. She's worried about fatigue. Am I going to make it through the school day? Can I make it from one end of the building to the other? Can I climb the steps? I had an 8th grader that I sent back this past year. She went the first day of school. She had neuropathy in her legs. She fell, and she never went back. She said, "I'm going to go back to school. I'm going to fall down the steps." "Well, let's do this and this." I'm not going back. Muscle weakness and low stamina. Neuropathy in the hands and feet. Can they take notes for long periods of time? Do they need a scribe? Can they run the track at PE? Can they participate in that presidential physical fitness testing? And I had one young man that's a 12th grader, and he said, "I never could do that. I still can't do it. I hate it." And he said, "I just tell them, I just don't do it." But then what happens? They get F's in gym. I mean, you really have to work to get an F in gym. Nausea and vomiting. Mood swings, the ones that are on steroids. ALL, you're on steroids once a month for 5 days. What happens there? I went to a little kindergarten class, and it was after lunch one day to do a little in-service, and he fell over on the rug, and he was kicking and screaming, I'm hungry. And I said, "But you just came in from lunch." He said, "Don't you understand? I'm still hungry." And he really was. Altered physical appearance, the scarring. Weight loss, weight gain. I had a young man I was working with that was in the 7th grade. Even in the summer, he'd pull the sleeves way down over his hands, and he'd pull them up sometimes when I was working with him. So he'd go, look at all these marks, Alma, they're so ugly. And they're not going to go away, he'd say. And what do? We expect him to go to gym class and change clothes in front of everybody with port scars and scarring and, oh my. So can't we get them an extra stall with a curtain on it, or the school nurse's office to change their clothes for gym? Hearing and visual loss, gross and fine motor deficits. And then you come to the cognitive challenges. Short-term memory loss, difficulty with word retrieval, and slower processing skills. They go together. I know one mom and I were talking earlier. I was sending a young man a couple years ago, and he was a 10th grader back to school, and he had Hodgkin's lymphoma. And he said, Alma, you don't need to go to my school. I got it under control. Everything's okay. And I said, oh, great. One less thing I have to do. And then he called me a couple weeks later, and he said, you better get over here. They don't understand. And I said, what are you talking about? And he said, they don't understand. They asked me something before I can even say it. They've gone on to something else, or they've marked it wrong. I go, So I went to the school meeting. We were sitting around the table. He'd go, it's up here. I know what I want to say, but I have to get it out, and I don't have time. So we had him tested during psych testing, and he did have difficulty with word retrieval. We tested him 18 months later, and it was much better. So we have to pay attention to that. Or is it just slower processing skills where they're thinking about their answers? The young group I was working with today, they told me these are two big areas. I work with a lot of young people with superior and high average intelligence. And they're juniors and seniors in high school, and they're getting ready to go to college. And when they're tested, as I said, high average, superior intelligence. But processing speed, on an IQ test, 90 to 110 is average. 111, 120, high average. 120 and above, superior. 120 to 129. Well, what happens there, they test and they're 118, 122, high average, superior. And then if you look at the fluency test in reading, writing, or math, it might be 90, which is average. So a school division will say, well, they're average. They're average, but look at those other scores way up here. So what does that tell you? They're having trouble with slower processing. Then what the young person says, I'm at home and I am making A's and B's and I'm doing well. But it's taken me 4 or 5 hours to get through the homework, and I have to read the paragraph over and over and over before I can answer the questions. Slower processing. Then you have poor organization, difficulty multitasking, inability to focus, and poor concentration. What does that sound like? Yes? Or they'll say, yes. Or they say, you know, schools will tell the parents, I think they're ADD. And then, you know, the parents are coming into clinic and saying, they're saying they're ADD. Do they need to be on medication? And I'll say, have you educated them about the late effects of treatment? Because if they're ADD or if it's late effects, it's two different ways to treat them. Now, you still might use meds, but sometimes it's just a minimal dose that's going to help the late effects. What I get, though, are these parents that come in and they have them on these high dose, and they'll go, it works for a week and then it doesn't work anymore, so then we change the meds. And the psychologist gives them a new one on the outside. And then they give them another new one. And they keep changing. It doesn't work. So you have to distinguish which is it. Social emotional challenges, lack of exposure to play groups and peers. If they were diagnosed as preschoolers, they might not have went to preschool. Well, then you're going to have a can of worms, because when they go to kindergarten, are they going to know how to share and know how to stay in their seat? I'm not kidding. I work with these little kindergartners sometimes, and I was working with one the other day, and the mom was a teacher, and I noticed he didn't know his ABCs, and I said, he doesn't know his ABCs, and he's going to kindergarten. I know they're going to do a screening about that, you know. And she said, oh, we didn't work on that. We worked on numbers a little bit. And he wants to play. He feels like he's missed out. And he's great with the older kids, you know, in the group. He wants to play. He's missed out. Variation in maturity level. My young people this morning that were here, they really jumped on they said, when I go to school, these kids don't understand. They're worried about what they look like. They're worried about the rock band and who's good and they said, we don't care about stuff like that. And I said, I don't blame you. It's okay. But they said they make us feel like something's wrong with us, and then they don't want to be our friend. Feelings of sadness, guilt, and worry. They meet a lot of friends in clinic, in the hospital. Some of those children or friends, they don't do well. And then you always have to worry with the survivors about the survivor guilt. Why did not my friend not make it? I work with a young man who's in his late 20s, and he carried around a book. When he was diagnosed, he was 11. He carries around a little black book that he would jot down the names of all of his friends and their birthday, but then the date he might have lost. Feelings of finding a social group in which to belong. We talked about that, and just feeling different. And then the spiritual challenges, and I was real impressed with the young group this morning. And they said, I really did that. Said, I asked, how come this happened to me and I am a good person? And it's people out there that are not very nice, and nothing happens to them. I said, well, you know what? I know you asked that question, and I know parents ask that questions, and I know siblings ask that questions. We all ask that questions. Why me? What did I do wrong to deserve this? Where is this all-loving God or other higher beings? Do I deserve to live this way? What is my quality of life? Loss, grief, and bereavement issue. I had a young man in there this morning too, and he became a little tearful, and he was one of the older ones. As he said, you know, when I got my diagnosis, it was this woman that lived near me, and said she was so kind and so nice and cared so much about me because I had cancer. And then she got cancer, and then she died. And he said, it makes me feel so bad. And I wondered why. Why did she have to? So you take all those big challenges we talked about, and then you think about school and the academic challenges. Curriculum and scheduling. Parents, you cannot wait till juniors and seniors in high school to determine what curriculum they should be in and what kind of diploma they're going to get. You know, it's about, it's about 7 different diplomas out there now. 7. Which one do you want your child to get? Standards of learning, state and district assessments that they have to pass, or they're told they have to pass them. SAT and ACT testing. I want to go to college, but you know, I'm slow processing. I need extra time. How am I going to get it? Career goals, career assessments. I was very impressed this morning. A lot of them in there told me that they had career assessments at school. And college or vocational training and transition issues. Transition, we can't wait till they're 16, 17 to talk about transitioning from high school to college. We have to start earlier than that. And vocational goals. What are our vocational goals for the ones who aren't going to college? And how are they going to learn to live independently? It's lots of issues that we need to address early on, particularly in regards to chronic illnesses. I always put this up here. It's a little old, but I still put it up here because I still think it's so true. Over on this side is teachers, their major concerns, and on the other side is parents, their major concern. And if you can see, they're a little bit different, aren't they? Things you're concerned about, are not at the top of the list, and I put them in order of what the teachers are concerned with. Teachers are concerned, is that parent going to give me enough information about that diagnosis, the medication, the side effects, and how I can best work with their child in the classroom? And do I have the skills to meet that child's needs? Now, teachers always say peer relations are good. Everybody in my class is supportive. Not always true, people. But then parents, they're worried about peer relations and the child having friends. And they're worried that they're going to miss so much school, and how are they going to make the work up? So they really do. Parents are kind of convinced that teachers do have the skills to be there. They just need to use those skills. So that's at the bottom of their list. How can parents and educators work together? They both have to share an understanding of the diagnosis and how it impacts education. Explore school health plans and educational plans, neuropsych testing and career assessments, how to educate classmates and friends, help the child develop advocacy skills, and assist with transition periods. Now, what do you do when they go back to school? You have a meeting. Parents have a meeting with the school. Educate them on the diagnosis, the treatment, the side effects, how it impacts them at home and at school, and then refer them to the child study team. At the child study team, they'll determine which evaluations are needed in order to get an educational plan and meet their needs. Do they need a medical, psychological, educational? All of these. Now, I can tell you on an initial referral, they usually do a medical, you bring the medical piece. They get a psychological, educational, a social history, and then depending on if they've ever had speech and language or OT/PT problems. But the first 4 you'll automatically usually get on an initial referral. School does it. They have a time limit to get it all done. Now, the school health plan with the school nurse is crucial because you want that school nurse to know your child. And because you got to tell them what the chronic illness is, the medications that will be given at school, procedures that might need to be given at school, and all the accommodations that are needed. Can they wear a hat because they have hair loss? Do they need to carry a water bottle and drink fluids all day long? Do they need 2 sets of books, one for home, one for school, so they don't have to carry all that weight on their back? Do they need an elevator pass because they have neuropathy and they can't get up the steps and they need an elevator pass? Or is the school crowded and do they need to leave 5 minutes early to get to their next class so that they're not bumped and bruised in the hallway? And then you determine what educational. After they do the testing, they'll determine, okay, we can serve this best in a 504 plan or an IEP. Or some schools will say, you don't need to do either. We'll do everything for your child. We'll do everything. You don't have to worry. Trouble is, if you don't put it on a plan, they don't have to be liable for it. If you have it on a plan, they have to be liable. So write it down. Get them to write it down. Okay, here's how you can go about, here's some laws. What constitutes a disability? Mental or physical impairment which limits one or more major life activities, has a record of such an impairment, and your dictation in clinic is that dictation, and is regarded as having such an impairment. Again, get your medical dictation. It's going to have it, usually the first line of the medical dictation. What's an impairment? Any disability, long-term illness, or disorder that substantially reduces or lessens a student's ability to access learning in the educational setting because of a learning problem, behavioral issue, or health-related condition. So what's your 2 phrases here that's really going to help you? A long-term illness and health-related condition. Now, what's going to get you in trouble with the school division? You in the back room. What's going to, this is the law. This is the law. Where do school divisions argue with you on this one? It's one part of this. It's one part of this that gets you in trouble. What is it? Yep, substantial. And they'll say they're making A's and B's. And you're saying, But my child is spending 5 hours on homework every night. So what are major life activities? And we've talked about chemotherapy, and interrupts the concentration. Being able to stay seated for long periods of time. The distractibility. And just thinking, just overall concentrating and thinking. 504 disabilities, here we go. The list could grow. And then what's IDA? The one part about this, it's always been free and appropriate education to all students. However, a few years ago, in 2004, it says to prepare them for further education, employment, and independent living. And that is what I think that made it better. We don't want, an IEP ends when they graduate from high school. We don't want our children just to graduate from high school. We want to know that they have the skills to be productive members of society. We want to know that they have the independent living skills, that they have a vocational skill, that they can get a job. Who qualifies? 2 to 21 years of age inclusive, and any child who needs special education or related services. And then of course the disabling conditions. And there you have the other health impairment for children who have been treated with a form of cancer. I went to a rural area the other day for a child who had a brain tumor. And the mother said, he's autistic. And I went, what? Can I see the IEP? And the school said, we don't have an IEP. We don't have any record of him being autistic. They went through the whole chart. They said, where? And I said, where did that come from? She said, a doctor told me he was autistic. I said, where's the record? She said, I don't have any record. That label was in his folder on one sheet of paper that said autistic. No IEP, no special education, nothing. Because he had, in the younger years, been developmentally delayed. And then I think when they needed to change that category, they labeled him autistic. But then they didn't follow through because he changed schools with an IEP. We had test results on him. He's fine. He's doing well. In fact, he's making A's and B's. My oldest daughter that did not have a diagnosis, but I kept telling her teacher, she was in that IB program all through high school, right. And I kept saying, it's very small classes, and I kept saying, she's ADD, and they said, she wouldn't be making these grades if she was ADD. You don't know what you're talking about. So I just, so she went off to Wake Forest, and she called me after, halfway through the semester, and she said, Mom, I'm failing every test. I don't mean one test. I am failing every test because they take my paper up and I'm only halfway through the test papers. And I wanted an unbiased opinion, so I let someone down there that I did not know. I did the research to test her. Came back that she had all this, fine, high average, superior, intelligent, blah, 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 but slower processing. And I gave it to the school, and it was documented, and then she got the extended time. And she got the extended time, when she took the GREs and all. Now, let me tell you something about grad school if we're talking about college, and this is just a little tidbit that I found out along the way. When you take SATs, you get to use calculators, okay? And when you take SATs, you can use the calculator. You take the GREs, you can't use the calculator. So that's when my daughter came to me and said, okay, I'm ready for you to teach me. You don't know how to use the calculator, Mom, but you got to teach me that old way now that you've been trying to teach me how to do math problems. Now, I'm not going to read these next list of accommodations. You have them on your handout. But look through them and determine which ones might be appropriate for your child. Really, really consider those backpacks, though. I think 40, 50, 60 pounds. And I was amazed today when the young people were saying they had weighed their backpacks. They were telling me how much they weighed. And they were up there 40, 50, 60 pounds. Too much on the joints. The ones that the kids this morning really liked was number 3 here. Assigned a moderate workload. They said, you don't know how much that would help us. We are so tired. They said, it takes forever to do the homework. So I was impressed. They were saying, can I write this down? And I said, I'll give it to you, so I gave them the sheet too. I said, ask for it, quality versus quantity. All teachers say, I don't give busy work. Let me tell you, I was a teacher. Every teacher gives busy work sometimes. They don't need to do the busy work. I'm going to share something about these young people too who are into the arts, because I live with one. The kids that are into the arts or the math or the kids who are perfectionists, man, they can't get their work done because they keep on and on. They've got to finish. And if they mess up a little bit, they'll throw it away. He told me he did that one. He said, I'll throw it away and then I'll have to start completely over. And I'll say, at some time you have to just say, enough's enough. I've done the very best I can do, and walk away from it. But they want to keep on and on and on and on. And particularly the ones who are doing art projects and all, they'll just keep on and on. Sometimes they keep working on them so much till they mess them up. And sometimes you have to say, it's perfect, it's going this way, it's going right now. And I didn't even address the young people who do their work, and due to their poor organization, it never makes it back to school. For that, I have found, those little plastic manila folders, and they're real thin, but they're plastic, and they'll have 6 little slots. I have found they work great, particularly for the ones, if you can mark them for them, and then they know all these papers go in this one, and now you still might have to, on Friday, have a backpack full of just papers crammed in. But if you can start training them that way with some tools, it sometimes helps. Does everybody know about neuropsych testing in here? Have y'all discussed that today? Get it through your insurance, through your medical facility. What does it cover? Attention and concentration, academic and language functions, learning and memory, problem solving and reasoning, and the visual, spatial, motor skills. It is crucial. It's crucial for kids who are going off, who are planning their curriculum in high school and who are going off to college. They have to know their strengths and weaknesses. I've had children be completely devastated and destroyed when they went off to college and they were in majors that concentrated on their weaknesses rather than their strengths. We talked today about that too. Don't pick a career because it makes a lot of money. Don't pick a career because it's a lot of jobs out there in that area. Don't pick a career because that's what mom and dad want you to do. Pick a career that you can feel passionately about, a career that you want to do, and that you can invest your interest in it. Had a young man several years ago, and he got to his senior year, and we had neuropsych testing. He didn't call me till almost his senior year saying, I need neuropsych testing. We kept talking about it, and he would not get it because he did not want to know what those weak areas were. It came back. He was a very verbal, had great writing skills. Unfortunately, he was in a curriculum that's concentrated on the math and the sciences, in which he was very poor. He was put on academic probation numerous times, got to be a senior, and the school kicked him out. So he had spent 5 years at a university that he was never going to get his degree from. I won't go any further, but he was devastated, and it was detrimental. So we have to teach them to learn their strengths and weaknesses, and we did do advocacy posters today, and I said, I don't care if you never show this poster to anybody else. Do this poster so you will be here today and you'll be thinking about it, and as you're talking to teachers and professors, guidance counselors and school staff, you'll be able to talk about who you are and what you need without really having to think about it because you've already done the work today. And I was amazed how a couple of them went to lunch, and within 5 minutes or 10 minutes they were back working on their posters again. They really did put some thought and effort into it. And for all of you with that age group, make sure you take those posters home today. Self-advocacy is understanding strengths and weaknesses, identifying the personal goals, legal rights and responsibilities, and being able to communicate them to others. Teens and young people, I went through this with them, know their healthcare condition and how to communicate it and talk about it, and what are the expectations of each class that they're going to be in, and what will they need differently, because you might need an accommodation in one class that you might not need in another. But the one for parents, stay involved with your child as they're getting older. I hate to hear parents say they're 18 and I'm done, my work's done. Parents, your work is never going to be done. Ever, ever, ever. Hold their hands a little longer. How many times do I go over to the colleges and meet with the Office of Disabilities and they'll say, now Alma, you know we don't hold their hands here. And I go, well, so-and-so, you know you should, because they've never walked this path before. Isn't it true as adults, if we start a new job, we want somebody to show us the ropes, mentor us, tell us how to do it. What's the next thing? When do we meet with the boss? What can I do and not do? We need to know that. Well, these young people need to know that. So we have to hold their hands and help them. And just because they're teens and young adults, it doesn't mean that they don't need us anymore. Mine, both girls say, we need you now more than ever, Mom. We don't know. One's getting ready to get married, and she calls me every other day and goes, do you believe I'm getting married? You think I'm ready to get married? Well, I hope you are, but I don't know. You know, they always need us. And straddling that line is so, so scary, as we all know. And transition, the movement from one period of life to the next. And there's our critical transition periods, and you know those. You know, it never ends. That's what I told the young people today. You're always going to have transition, always. And you're always going to have to deal with it. And it brings so many emotions, so many. And we talked about these today. And most of them, a lot of them talked about the anxiety and the fear. Your grandson talked a lot about approaching this senior year and feeling kind of a little bit anxiety, but tranquility, peacefulness. I finally made it, you know. So, you know, and hope, good things. Molly shared that she was excited about her starting her next year, and said, I always have a little worry and anxiety, but just excitement and looking forward to it. And here's some programs that may help in the future. In services for the parents who have young children, in services for staff and peers. And I talked to the young group this morning about this too. I said, we have to talk to our friends and our peers about our diagnosis and about what we need. And I took it out of the cancer role and I put it in the regards of Tourette's. Does everybody know what Tourette's is? Well, if you have a child in your room and they have the vocal tics and all, and they have Tourette's, the other children don't understand. But the teachers and everybody's saying, oh, you have to be supportive, you have to be a good friend, you have to be encouraging. But they don't understand. So what do young children do? They make up rumors. They bully, they tease, because they want somebody to explain it to them. I used to do so many in-services in the classrooms of young children diagnosed with leukemia or a brain tumor, transitioning back to school, and I took my puppets and the hair came off and it went back on, and they had portacasts, and the little people got to feel what a portacast felt like, and then I would show them what it looked like before it was placed under the skin. And when I left, they were so supportive. I'll never forget, I was a little boy with a brain tumor, and he was in 4th grade, and he was scared, and he went to school a few days, and he just wasn't happy, and they said, will you come and do an in-service? And he wore that baseball cap every day. That day I went and did the in-service, and he sat up front, and he acted like I wasn't there for him. I wasn't talking about him, but I was talking about the diagnosis of childhood cancer and having to wear a baseball cap. And that the hair grows back and da-da-da-da. And the class was so supportive, and they asked appropriate questions and all. And when I left that day, and I got to the door, and I turned around and looked, and he looked at me, and he gave me a big grin, and he took the ball cap off, and he laid it on his desk. He suddenly felt comfortable, and I never had to go back there again. The same as a parent called me one time, and they had a 3-year-old who had a brain tumor and had the scars and lost the hair and was on steroids and was bloated and puffy, and she said, I want you to go and talk to his class. And I said, you want me to talk to 3-year-olds about childhood cancer? I said, I don't do 3-year-olds, sorry. And she said, won't you please? She said, they won't play with them, they're scared of them. So I took my Fisher-Price doctor kit and my Band-Aids and all the things and my puppets again and and I talked about boo-boos, and I talked about bad boo-boos, not so bad boo-boos. And if you get a little scratch, it's not a bad boo-boo. You put a Band-Aid on it. But what happens if you have to go to the hospital? And they said, oh, that's a bad boo-boo. And then we talked about medications and side effects. Now, a 3-year-old will tell you, Mama gives me Benadryl because it makes me go to sleep. Well, that's a side effect. Yeah, that's a side effect.
We didn't know anything about
so,
this moment.
if you take this medicine because you have a really bad boo-boo, like so-and-so, then you might lose your hair, but it always grows back. When I left, they were rolling, they were kissing him, they were rolling and wrestling, and I never had to go back again. So we have to educate. We have to educate. And I was so, today when I left, one of the young people said, I want your job. I want to be able to do that. So they do think it's important. Career assessments, they are important. You have to know where they're going. And just because you get a career assessment in middle school, or even when you're a junior, senior, doesn't mean you can't get one when you're again in college. Your interests, your values, and your abilities, and what are you suited for? And some more projects we do for the little ones at our hospital. Sometimes we take the video camera and we follow them all around clinic and through their treatment for a whole day, and then they can take that and they can show their classmate what their day is like at the hospital. The summer enrichment program, I talked about how they come in for 1 week, 9 to 3 every day. And they talk, and they'll say, I love being here because everybody understands what I'm going through. We have academic enrichment. We have cultural enrichment. And I just had that Fredericksburg group called Engineering for Kids, and they had the Legos, and they made the little wrestlers, and then they wrestled, and it was a competition. They thought it was so much fun. Monthly discussion groups. Parents go in one room and have a big discussion, and the kids go in another room, the little ones, and then the teens go in another room, and the siblings go either with the teens or the young group, depending on their age. Retreats, overnight retreats, to come in and have educational workshops, but the socialization. Transition forms for, we do those for 3 years of being off treatment, up to a year of being off treatment. A lot of anxiety for parents. How many children have we served here recently who have come to us and said, I don't want to quit taking chemotherapy. It's made my cancer go away. If I quit taking chemotherapy, it's going to come back. One young boy was in 3rd grade, and he was really struggling and behaviorally and academically, and just didn't seem to care this past year. And as a psychologist, and we started working with him, we found out he thought he had quit taking his chemotherapy, so he thought for sure he was going to die in 6 weeks. So we have to answer those questions. We have to clear them up. And then we always do a big graduation celebration, and some of them today talk to me because we give scholarships out. So, I have a list of scholarships that are given that I've kind of gotten together over the years. So if your child ever gets to that age, and they're saying, hey, what's some scholarships? Now, Mom and Dad, don't fill out the scholarships for them. Make them do it. But get them to email me or call me, and we can talk about maybe what scholarships are available.